Good afternoon, everyone. My name is Chris Palmer. I'm a psychiatrist here at McLean Hospital, and I'm the director of the Department of Postgraduate and Continuing Education. It's my pleasure to welcome you to our live webinar. This webinar series is a new thing at McLean Hospital, supported by a generous gift from a family who's been affected by borderline personality disorder. So it's completely free and really as a service to our patients and families and those trying to support people with borderline personality disorder. Before we get started, I have just a few logistical announcements to make. So one is that we have over 400 people registered for today's webinar. So there are a lot of people coming on. Other participants won't be able to see you or your name. All of your microphones have been muted, so you won't be able to speak with us, but you will be able to interact with us by chatting in the chat box and texting us questions. Given how many people we're going to have as part of this webinar, we probably won't be able to answer everyone's questions, but we will do our best to get to as many of them as we can. A few logistical things before we get started as well. I want to kind of show you an overview of the different screens. You should have 4 different sections on your screen. So the one that I'm in right now are going to be the slides for the presentation. Over here, you should see a picture of the speaker. You should see me right now. There are these small boxes in both upper right-hand corners with 4 arrows pointing out. If you click on one of them, you'll only see that box. So if you are currently only seeing slides, or if you are currently only seeing my video, you want to go up in this upper left-hand or upper right-hand corner, look for the box with 4 arrows pointing out and click on that so that you can see both the video and the slides. Additionally, we are recording these webinars. We have a webinar from last month that's already posted on the website, and we'll have future webinars, and you can learn all about all of the webinars that we're offering at this website. So if you click on this link right now and add it to your favorite list, or down here in the announcement, if you download this announcement, you'll be able to sign up for the next webinar. I want to give you some brief information on the next webinar. It's going to feature Maureen Smith, who's the director of our family services, and that webinar is going to be a different format than tonight's webinar. Tonight's webinar is going to focus on mindfulness as a treatment for borderline personality disorder, and it's largely going to be a presentation with some time for questions and answers. But we've had feedback already that a lot of you, families, and others are struggling with specific issues, and you want more time for questions. So next month's webinar is going to leave most of the time for really questions and interaction with all of you. So if we don't get to your questions today, please come back next month. It really will be an open format. Again, if we have over 400 people, we probably won't be able to answer everyone's questions, but we'll do our best to get to them. And with that, it's my pleasure to introduce tonight's speaker, Dr. Blaise Aguirre. Dr. Aguirre is the medical director for the McLean program called 3 East, which is a program that serves girls and young women with emerging traits of borderline personality disorder. And he's also an assistant professor of psychiatry at Harvard Medical School, and he's going to be speaking with us on mindfulness. I hope you enjoy his presentation.
So welcome everyone. It's absolutely wonderful to see so many people logged on from all over the world, connected in this moment to talk about something that's really important, certainly for me, and that is the topic of mindfulness, and in particular in its application to borderline personality disorder. And whether you have borderline personality disorder, know someone with it, or treating someone with borderline personality disorder, or just interested in mindfulness, hope you enjoy this talk. You might be in therapy or not. You might be doing psychoanalysis, DBT, MBT, TFP, CBT, cookies and tea, no therapy at all. But mindfulness will enhance any of these psychotherapies. So with that, let's see. What I want to do is just talk a little bit about mindfulness. And the way I'm going to talk about it in this context is as the core skill of dialectical behavior therapy, DBT, which is the treatment that I'm trained in. To talk about mindfulness as and how we would use it in borderline personality disorder, and to give you some examples, some practical examples of how you can use it in ordinary life and also when life gets out of control. So this is, I think, to me, the most useful definition of mindfulness. And it is Jon Kabat Zinn's definition, which is paying attention in a particular way, on purpose, in the present moment, and without judgment. So what this means is that you're focusing your attention to the present moment. And I have to tell you, this is much harder than it sounds. Our minds tend to be in the past or the future rather than the present moment. So it's actually quite a difficult thing to do. That you're doing so with intention. You might catch yourself at times paying attention and say, well, wow, I was paying attention, but it wasn't done with intention. So I want this to be an intentional practice. And the particular way is the way in which mindfulness will work for you. So some people like to do breathing. Some people like to do walking mindfulness. Some people like to do prayer. I'm not proposing any mindfulness practice per se. It has to be the practice that works for you. And awareness of the present moment and awareness generally flows between mindfulness and mindlessness. So you can be very present and very aware mindfully, and awareness can then slip away and you can get into the habit of your life. So why is it so important? Why am I so dedicated in this press to teach mindfulness to people with borderline personality disorder? So what we know is that strong emotions disrupt a person's ability to think. Now that happens to me. I might appear pretty mindful right now, and hopefully I am, but when I get upset and angry and dysregulated, my ability to pay attention and to think goes out the window. So whether I have borderline personality disorder or not, is the brain works that way. And the problem is that when you become very emotional, and emotional sensitivity in people, well, when you become very emotional and emotions begin to rocket, this then leads you to less of an ability to think, which leads to stronger emotions, and you get into this vicious cycle. And because borderline personality disorder is at its core a problem in regulating not only relationships but also strong emotions, this is a particular problem with people with borderline personality disorder. And the problem then is that these very strong emotions can lead to destructive, dangerous, and impulsive behaviors. And these behaviors have a lot of consequence, and among others, disruption in relationships with people that you love, with people you don't love, with therapists, with friends, with lovers, and then just consequences to yourself. So mindlessness means that the pattern of strong emotions, dangerous behaviors, and with interpersonal consequences repeat over and over and over again. Mindfulness is the skill of bringing an enduring awareness to these patterns. And by bringing awareness, you have now the option of deciding what it is that you're going to do before emotions get too strong. So with that, I'm going to do a little practice that I want everybody to do. And each of these practices are going to take about 60 to 90 seconds. Now, what I want you to do, and especially for some of you younger people who are probably multitasking, is stop it. I want you to put away the cell phones and all the other electronics that you have, and use this thing called pen and paper, which the older people will recognize. Clearly irreverent there, but I want you, if you want to take notes, do it on pen and paper. I wanted to tell you something about the bell. Some people are put off by the bell in mindfulness because they think it has religious connotation. And mindfulness is not a religious practice. It is a practice in awareness. And so when we ring the bell, just think about this. You know, you have bells in schools, and you've got bells as alarms, and you've got bells in churches, and you've got farm bells, and you've got dinner bells, and bells all over the place. So in mindfulness, it's just we're going to start mindfulness, and then we're going to stop mindfulness. So when I ring the bell, that'll be the start, and when I ring the bell the second time, that'll be the finish. So what I'm going to do is I'm going to ring the bell, and I want you to, when I ring up, well, the first thing I want you to put your hands on your lap. I want you to put your feet on the ground, or if you want to sit in lotus, you can sit cross-legged on your bed or in a chair. And I want you to take a breath, and I want you to focus your attention on finding an itch somewhere in your body, and I want you to do nothing with that itch. And I'm going to ring the bell and start. As your mind wanders, go back to the itch. So what did you, here's what I want you to do, and maybe you can make a little note of this, and we can chat about it later. What did you notice? Did you notice that the itch moved? Did you notice that you had an urge to scratch? Did you notice that you had multiple itches? Did you notice that you had no itch? Did you forget what we were practicing in the first place? What happened to your mind? Now, there's no correct answer. Each of your experiences is your own private experience, and it's just the experience that you had. And this is really important, that whatever happens to you is your own experience, and you can notice it, and you can pay attention, and you can notice how easy it was or how difficult it was to do. Okay, so why practice mindfulness? Now, I tell you that perhaps for me this was the most profound finding, and that is that most of our lives are just lives of mindless habit. And we're typically unaware of these habits. Now, generally speaking, having habits is absolutely helpful. You don't want to spend hours thinking about how it is that you're driving a car. Most of it is just automatic and repetitive. And so there's no problem with these habitual patterns. But there's a problem if these habits cause us harm and cause us suffering. And it's very difficult to change habits if you're not aware of them first. So mindfulness seeks to bring into clear focus the entire experience that you're in the present moment, what your mind is doing at any given moment. So mindfulness is not about changing anything. You're not going to change anything. You're not going to push things away. You're not going to act on it. You're not going to act on urges. You're not going to do anything. What you're going to do is just be aware of what your experience is. And once you're aware of it, then you have a fighting chance of deciding what it is that you're going to do or what choices you're going to make. So, and I'll go back to this slide. Now, I want to teach you a little basic neuroanatomy. And these are the two of the important areas in the brain. You'll see the purple prefrontal cortex, and you'll see that little red-yellow part on the underside called the amygdala. So just keep those in mind as we go to the next slide. All right. So the prefrontal cortex is the part of the brain right behind your forehead. And it regulates emotions and decision-making, and it focuses attention. In people with borderline personality disorder, compared to people who don't have borderline personality disorder at the same age, the prefrontal cortex is relatively underdeveloped compared to people without BPD. Now, this has nothing to do with intelligence. We find many people with BPD to be very bright and very intelligent. It's not an intelligence thing. It's just an ability to regulate emotions and decision-making and focusing and attention. Now, what we know is that repeated mindfulness practice strengthens this part of the brain that is weak. Also, mindfulness reduces hyperactivity or a lot of activity in the amygdala, which is the part of the brain that I showed you in the previous slide, the amygdala. So there it is. So mindfulness reduces hyperactivity in the amygdala, the part of the brain that is relatively overactive in people with BPD, and is the part of the brain that is responsible for all the intense emotions that people with BPD experience. So by strengthening the attentional circuits of the brain in your prefrontal cortex and reducing the overactivity in the amygdala, any person, whether it's me, you, person with BPD, the airline steward, anyone, will improve their ability to regulate their emotions. So what we also find is that different types of mindfulness activate different parts of the prefrontal cortex. And so in the same way that different exercises strengthen different muscle sets, different mindfulness practices will have different effects. And it's important for you to find the practices that work for you. Because, for instance, we know that in people who have had trauma in their lives, simply sitting there and breathing can lead to an influx of a lot of unwanted memories and thoughts. So maybe a breathing practice is not the practice for them. And maybe it is a yoga practice or a walking practice or a drinking tea practice. So you'll have to find the one that it is for you. But I'm not prescribing any specific mindfulness practice. Now, in this day and age of high healthcare costs, we have some pretty robust research that shows that mindfulness practiced alone decreases anxiety and panic disorder, depression, binge eating, numbing and avoidance and post-traumatic stress disorder, chronic pain, symptoms of fibromyalgia, and others. It improves self-regulation, attention and concentration, especially it's been shown to work in people with ADD who are intolerant of stimulant medication, interpersonal functioning, immune response to HIV, and many, many other health benefits. Now, here's something you don't have to call your insurance company to get it authorized. You don't have to worry that you're doing it too much. You can practice it whenever you want. You don't need a prescription, although sometimes I'll give some of the people I work with a prescription for mindfulness as a reminder. But this is something that you can do for yourself for free whenever you want. So what is the difference between mindfulness and meditation? So mindfulness, we've just talked about, is the act of consciously focusing your mind in the present moment without judgment or attachment to the thoughts that are flowing through your mind. Whereas meditation is a more formal practice of mindfulness, and that you can do this. You set time aside every day or once a week or whatever it is to practice mindfulness, whether it's a breathing practice, a yoga practice, a walking practice. So if you think about it, it would be, you might think of yourself as a religious person, but you're not only religious when you go to church or temple to a service. So that would be the more formal practice, going to church or a temple, whereas being spiritual or being religious can happen anytime. You don't have to do anything formal. So whereas we use mindfulness in a very secular way, many religious practices have meditative and contemplative practices in Judaism, Buddhism, Islam, and Christianity. And you don't have to stop doing the practice that you're doing in order to do mindfulness. So this is, you can do it whether you have faith or don't have faith. It's not important to believe in God or not. In the context of mindfulness, it will be important for you to whether you believe or not. Okay, so now I said that I use the dialectical behavior therapy, DBT approach in the context of mindfulness. And so DBT teaches that a person with strong emotions and borderline personality disorder is primarily in one of three states of mind. One that we call reasonable mind or rational mind, a mind that we call emotion mind, and wise mind. So and each of these has their benefits and their downsides. So reasonable mind or rational mind is colder, more analytical, more fact-based. And this is the kind of mind that you want to have when you are taking a math test or doing something, studying your homework, your biology homework, or building a bridge. You want to be rational, fact-based, and not allow too many emotions to come into the decision. Emotion mind is passionate, hot, a lot of body sensations, and there's a time for emotion mind when you're at a friend's wedding, when you're sad at a funeral, when you're at a baptism, when you're staring into your loved one's eyes. So this is a time for emotion mind. But too much emotion mind can get complicated, and too much rational mind can get complicated too. There's times not to use those minds. Wise mind is this integration of all possible states of mind. It is settled. When you reach wise mind, you'll feel this incredible settled feeling. Muscle tension flows from you. It's sometimes people call it a gut feel, intuitive. And wise mind integrates what at times can seem totally opposite states of mind into sort of dialectical synthesis. It finds wisdom in all the different perspectives and all the different experiences that you're undergoing. And so the importance within DBT is to attain wise mind so that you can make wise mind decisions in the context of very difficult situations. So the problem for many people is that the idea of mindfulness was too complicated. They thought, you have to go off to Tibet and sit in a cave and find enlightenment that way. But DBT broke down the skills of mindfulness into pretty easy to learn ideas. So the first one is that you want to do it with intention. Many of us do lots of things without intention. We're not paying attention to the mindlessness of our lives. So you're setting some time aside to do mindfulness. The next thing you want to do is simply observe. And if you can think about going to an aquarium and then just watching fishes swimming back and forth, observing is just noticing. Next comes describing, so that you're observing, you're just noticing, and then you're putting labels onto the things that you're observing. Again, if you think about the fish tank, You might describe the color of the fish or the types of fish or how they're swimming, etc. And then you want to fully participate in the experience. You just want to be there. When you're doing that thing, just do that thing. So what I'm going to do now is we're going to do our next little practice, and I want you to observe the slide I'm going to show you and notice it for a little bit, and then start putting descriptive words into what it is that you see. And I want you to fully immerse yourself into the practice of just looking at this next slide. And I'm going to again ring the bell because that's going to say we're going to start the mindfulness practice. Again, a posture, stillness, breathing, just noticing. So what is it that you noticed? What is it that did you judge? What do you know? What you were doing is that you're practicing this with intention, that you were doing this practice with the intention of just focusing on that photograph. Were you able to put words to what you observed? That the tie had stripes, that there was a man and a woman. They may have been familiar to you and you were able to label who they were. But what you don't know what they're thinking. You don't know where they are. You don't know what their experience is. You might guess at those things, and that those guesses may be trivial. But you can see if you start thinking that you know what they're thinking, where that can lead to a lot of trouble. Now, many people say that they're not judgmental, and yet they can look at a photograph like that and judge a lot, one person or the other. And think about that for yourself if you consider yourself not to be a judgmental person. Are you judging? And there's nothing wrong with judging per se, except if they get you into trouble. And in mindfulness, if you're noticing judgments, that's also okay. That you can say, oh, wait a second, I'm judging. Now, judgments within judgments, there's often a condemnation. There's something about the experience that you just don't like. Now, that's very different from preferences or an assessment. So you can say, I like chocolate ice cream and not vanilla without judging it. You're just marking that as your own preference. To say that chocolate ice cream is disgusting would be judgmental in that it may be disgusting for you. You can mark that as disgusting for you, but it's not true necessarily for other people. So notice those judgments. Focusing on one thing in the moment, so that while you were looking at that photograph, were you also texting? Were you on your email? Were you watching TV? What else were you doing? Do so effectively. Do what the situation needs. Notice your desire to be right over being effective. All right. Now, here's a quiz. Which of these is a mindfulness practice? Washing your car, doing your nails, sitting in a yoga pose, praying at a church, reading, playing Candy Crush, one of my favorites, doing the dishes, listening to a lecture by the Dalai Lama. So just think about this for a second. Which is a mindfulness practice? So here's the whimsy of mindfulness. They all are and they all aren't. So it's not the activity itself. It's the attitude and intentionality that makes it so. So that's why there are infinite practices in mindfulness. Everything that you can do mindlessly, you can do mindfully. And so that's why, certainly on our unit, one of the things that I stress is that when people say, let's play a mindfulness game, that games can be played mindfully, certainly. But typically they're played mindlessly. It's just a fun, trivial activity. And that mindfulness is more of an intentional practice. So when you're going to do mindfulness, do it as a practice. Okay, now, one of the things that many parents and therapists or other people who don't understand necessarily the difficult behaviors that people who have BPD struggle with is this idea of urges. And so that, okay, if someone has the urge to self-injure or to do something self-destructive, why can't they just stop that? Because they themselves, as they don't struggle with BPD, if they had the urge to do something, would be able to stop it. But urges can be very difficult to manage. So what I want everybody now to do is I want everybody to observe the urge to swallow without swallowing. So what I'm going to do is I'm going to ring the bell. I want you to swallow if you need to swallow right now. Take a breath. And I'm going to ring the bell and just notice that urge. So here we go. Take a breath, sitting mindfully. So you may have noticed that initially it was fairly easy to not swallow. But as time went on, the urge to swallow became more and more difficult until the point where you may have swallowed. But that urges aren't simply as easy as not necessarily not doing them. But the practice was just a practice in noticing what happens to you and what happens to your mind and to your experience when you're doing that practice. So how can you integrate this into your life, into your everyday? And as with anything, if you're going to learn a language, learn a musical instrument, whatever it is, you get most bang for the buck if you set aside some time to do it. So if you're going to learn a language, set some time to go and learn that language, or piano, set some time aside to go and learn piano. And set some time with intention to go and practice mindfulness. But here's the thing is, whereas with the piano lesson and the language lesson, you might have to go somewhere. You don't necessarily have to do anything out of the ordinary in your life. If you are going to have a cup of tea, do so mindfully. Notice the cup in your hand. Notice the liquid going down into your mouth and down your throat. Notice the sensation of satisfaction. Notice putting it down. Don't have anything else happening at that time. If you're praying, pray. A lot of people have prayers that they know and just repeat mindlessly. Know the words. Say each word, what each word means. Pay attention to your experience while you're saying each of those words. When you are driving, just drive. Turn the radio off. Put your cell phone in the trunk. Just drive. When you're eating, notice each flavor and texture. When you're showering, just shower. When you're eating, know you're eating. When you're bathing, know you're bathing. When you're washing dishes, know you're washing dishes. So any one of these things can be a mindfulness practice, and there are infinite of them. So you don't have to go anywhere. You can do it in your own home. But be kind to yourself. That many people find the journey to mindfulness to be very difficult. That paying attention seems to be the most impossible thing in the world. And that as they try to pay attention, their mind wanders to the past or the future. So be kind to yourself on this journey. There is no getting it right or getting it wrong. It's a skill set that's going to make suffering less intense. This is a book that we wrote for borderline personality disorder, mindfulness for borderline personality disorder, and we have many more examples in there. And if you're more interested in research, there hasn't been that much research on mindfulness per se in borderline personality disorder, but there are about 15 studies that have looked at it as a single skill set for BPD. And a copy of these slides can be downloaded below on our website. So, for example, here are just some of the research findings. But I've tried to summarize all of the research findings in our slide set that will accompany this presentation. You can get them from the McLean website. So with that, and we were instructed that people want to ask a lot of questions and to leave enough time for those questions, please go ahead and ask any questions.
Great, thank you, Dr. Aguirre. One question that we've already had come in is a question about meditation for patients with symptoms of dissociation. Meditation or mindfulness contraindicated?
Yeah, I actually think that when I first started the practice, I similarly noticed that people who were struggling with trauma and dissociation and dissociative identity were really struggling with the forms of mindfulness that involved sitting quietly. And I don't recommend any quiet mindfulness practice for people with dissociation, especially if they can't tolerate it or if they have a lot of intrusive thoughts and memories.
So,
There are other...
Dr. Aguirre, I'm sorry. I think that people couldn't hear my question. My microphone was muted. I'm sorry. So just to repeat, the question that Dr. Aguirre is answering is whether mindfulness might be contraindicated for patients, people suffering from symptoms of dissociation or psychosis.
Yeah, and so I think, again, with quiet forms of mindfulness and contemplation, I mean, not to say that it cannot be done, but for a lot of people, they find that, hallucinations and intrusive painful memories, prevent them from doing some of the breathing mindfulness practices. And but there are other forms of mindfulness. This is where you can drink a cup of tea mindfully, you can garden mindfully and just focus just on the gardening, or you can use sensations, smells, smell a smell mindfully, have a meal mindfully, have a discussion mindfully, and it's just bringing your total awareness to that task. So even people who have dissociative experiences or with psychosis can bring their attention to the present conversation, for instance, or to the present meal. So I would absolutely agree that forms of stillness and quietness in terms of mindfulness aren't useful for people with psychosis or hallucinations and dissociation, but not that they can't.
Great. So Dr. Aguirre, another good question. So for those who have seen loved ones with BPD whose emotions seem to go from 0 to 60 in a split second, how can you use mindfulness to be helpful for them?
So this is a wonderful question, and it turns out that even though it can seem as if they're going from 0 to 60 in a split second, it turns out that if you actually start to pay attention to your vulnerability factors, that you actually have a fighting chance of it not being this seemingly sudden switch in emotional intensity. Not to say that it can't happen, but typically, for instance, people will describe these 0 to 60 moments, but there's often other problems, like that it happens late at night, that they're not sleeping very well, that they haven't eaten, that they haven't exercised, that they're maybe sick, and that if you notice patterns of behavior, like every time that I speak to my boyfriend late at night, I get into a fight with him. It can seem as if it suddenly happened, but if you can start noticing much earlier on things like, wait a second, it's getting late, I'm becoming tired, I can notice my mind getting tired, I notice that every time we speak late at night, we get into a fight. Maybe you can then decide that you're going to have a discussion earlier in the day. Or if every time your loved one has a request of you, go clean up your room or whatever it is, you notice that you're becoming very agitated, to sort of begin to anticipate that this is one of the things that your mind does. And you can then say, okay, maybe I'm going to have a more calm discussion with this person that I care about, who clearly, in most cases, doesn't want to set me off, and yet I get set off by those situations. So, when you ask me to do certain things in this kind of way, I then have these kinds of reactions. So by you changing your behavior, by me paying more attention to my response, I can begin to change the variables in my day-to-day life that will allow me to have a different response. Now, clearly it's not going to happen all the time, but as with anything, the more you practice mindfulness, the more you practice that ability to pay attention, the more of a fighting chance you have to use it in different contexts. So it does appear to come on very rapidly, and it's true that people with borderline personality disorder have quick changes of emotions, but it turns out that it doesn't actually happen that quickly most of the time, that there are factors that you can begin to pay attention to.
Great. So Dr. Aguirre, then a couple of people have asked a related question about for those family members or loved ones, spouses, siblings of a person with BPD, how receptive are they to even hearing suggestions from the loved one or family member about possibly doing mindfulness? And on a day-to-day basis, how could family members or spouses or loved ones be able to remind the person, like maybe you should be mindful, or how would they even be able to tell if the person is being mindful or not?
When I first discovered mindfulness, I went around telling all my colleagues and all my patients and anyone who would listen to me that they had to do mindfulness. And I got zero response, and I got told to go away because I was being annoying and that this mindfulness stuff was nonsense. For me, people started to practice a lot more when I started to live the principles of mindfulness, which is just to pay attention, to notice. And it's as with anything else. Telling someone what they need to do or not do is generally not that effective for any of us, whether you have BPD or not. Telling you to drink or not drink, telling you to practice a religion or not religion, whatever it is. We don't want to be told what to do. But by me practicing mindfulness and being quieter and being stiller in my interactions with people, they became a lot more curious about what it was that I was doing, and then we could talk about mindfulness. So I don't think that telling someone to be mindful is going to get them to be mindful, but being mindful will not only improve your relationship with others, but might get others to be curious about what that is. And even if somebody doesn't want to do mindfulness, the fact that you're being mindful is going to give you a calmer experience. So you don't have to, it would be nice if others did it, but at least do it for yourself.
Another question, Dr. Aguirre, is how different or similar is mindfulness to the relaxation response?
Yeah, mindfulness and relaxation are two totally different things. Now, you can relax mindfully if your intention is to relax. But mindfulness is about paying attention to your current experience. Now, if you're in tremendous pain or distress, bringing your awareness and your attention to that may not be calming at all. And so I'm hardly, and actually might be even more painful. But at least you're dealing with reality as it is, and then you have a chance of maybe doing something that is more effective. So it's not about calming or not calming. I certainly know that the more I practice mindfulness, the calmer I have become. But these are two separate constructs. Mindfulness is awareness, and calming is calming. And people can do calming things without being aware, or calming things with being aware. But mindfulness is about paying attention. And I have some of my clients who've told me that it's actually very painful to be mindful because of intrusive thoughts, and it's not very calming at all.
So actually, that's a great lead into this next question. Is mindfulness an effective tool after a trauma nightmare?
Is mindfulness an effective tool after a trauma nightmare? Well, I think it depends on what it is that happens after a trauma nightmare. If after a trauma nightmare, a person is able to go on about their day without any consequence, then maybe you don't have to pay attention. The issue then becomes is, does that trauma nightmare elicit a set of behavioral responses that and emotions that are very, very painful and difficult for the person? And so mindfulness, in terms of paying attention to what your experience is and self-validating and saying that was what my experience was, can be a useful first step in terms of deciding what it is that you're going to do about it. And what it might mean is medication changes or using the nightmare protocol or whatever it is. But mindfulness isn't about something in the past, or you cannot be mindful about tomorrow or mindful about the past or mindful about a nightmare. You can only be mindful about what is happening in this present moment. So no matter what's happened to you in the past, like a nightmare or whatever it is, all you're doing is paying attention to whatever your current experience is, which may have been caused by the terrible nightmare, but at least you're aware of its consequences in the present moment. And then from that, you're able then to decide what to do.
Dr. Aguirre, I guess I'm wondering whether the question really is more about a person who has a trauma nightmare, wakes up in bed in a cold sweat, isn't quite sure, can't get back to sleep because that was a horrible experience, and now what do I do? And could you talk about how mindfulness might play a role in that scenario?
So I actually think that during intense experiences like that, I probably would not recommend mindfulness in those contexts. Because what you want to do is, if you remember the slide, we'll go back to it. Um, let's get to the brain slide. So you've got the amygdala there, and that's firing like crazy during intense emotions or after a horrible nightmare. And mindfulness probably would not be all that helpful. I would do something that would very rapidly change my emotional experience, such as maybe jumping in, taking a cold shower, or putting my face in a cold um, um, a bowl of cold water, do intense exercise, maybe take a medication. When you're in the depths of such extreme anxiety and emotionality, it's going to be very difficult to do mindfulness. So mindfulness begins to prepare the brain for paying attention, but in the context of those extremely emotional experiences, it's probably going to be very difficult to do mindfulness.
Great. You've answered a couple of other people's questions, I think. In terms of mindfulness, how would one go about treating suicidality with mindfulness, or how can mindfulness play a role?
Well, yeah, this is a very tricky question. I think that suicidality, when you start to break it down into sort of its elements, like what does it mean to not want to live? What is not wanting to live made up of? What are its component parts? So often people will have awful emotional and cognitive experiences and say, I simply don't want to live. But if you to break some of those down, you might say, I don't like the sadness that I am experiencing. I don't like the rejection that I'm experiencing. I don't like certain aspects of myself. If you can begin to break those down by paying attention to that, because nobody is all bad. And I know a lot of people with borderline personality disorder will often say that they are absolutely terrible people with nothing good in them. And yet they do some wonderful things. Well, you cannot do wonderful things if you do not have those wonderful things inside of you to give. You cannot be kind if kindness is not within you. You cannot be generous or compassionate if compassion is not within you. And so if those things are within you, then you cannot be all bad. And so discovering some of those things about yourself. So in terms of suicidality, rather than the sort of broad suicidal, is break that down. What does that mean? What is it that I am dissatisfied with in this present moment? And pay attention to it. Often, if you walk into a very dark room and you hear a noise, it can be terrifying. And so the thing is to turn on the light. And when you turn on the light, you see the thing that terrifies you. And maybe it is something terrifying and you turn around and run. But maybe it's just your brand new puppy dog that was rustling around on papers. And then it's less frightening. Mindfulness shines a light on those fears, on your experiences in such a way that you then know what to do with it.
Great. Another participant asks about her son who has had some DBT therapy in the past. And when he is exposed to really stressful events, he tends to shut down and wants to, in order to prevent himself from being impulsive. He needs to be by himself and sleep. I, as a parent, would prefer that he would talk to us, but this seems to be how he soothes himself. Is this avoidance, or is he possibly practicing mindfulness? Is he mindfully trying to soothe himself?
Depending on how much mindfulness practice and how much DBT practice he has, it could be any of the above. I mean, typically speaking, in people with borderline personality disorder, um, avoidance is a common finding, and wanting to crawl into bed and just leave the world is better than the alternative, which is to be very self-destructive at times. And so they may or may not want to talk to you about it, and it may or may not be mindful. I mean, the way that it was described, it sounded more like avoidance than not. So, I mean, I don't know what's in the young man's mind, but on the other hand, if they've practiced a lot of mindfulness and DBT, it's possible that he is effectively using um, mindful resting in order to get through that moment. Um, I wouldn't know without his explicit.
Is there a way that, as a parent or a treater, is there a way to help him work toward a way to be able to tolerate stressful events instead of completely retreating? Because as I'm thinking about this boy's life, if he's in school and has a stressful event, does he have to go to the principal's office? Does he have to go home? Does he, if he's at home, it's hard to have a functional life when every time you get overwhelmed, you have to remove yourself and go take a nap or be in a room, a quiet room by yourself. So is there a way to use mindfulness or other skills to gradually be able to help this boy be able to tolerate stressful events?
You know, distress tolerance, the ability to tolerate distressful events, is one of the fundamental signs of emotional wellness. So that in all of psychiatry and all of wellness and human health, that our ability to say, I'm having a very difficult moment and I can still continue to do what I need to do is essential. The more anxious you become and the more emotional you become, the further you get from the prefrontal cortex, the further you get away from the ability to think. So the practice of distress tolerance skills and mindfulness is certainly a way to get there. Now, as with any other practice, as with any other skill, the more you practice, the better you get at doing it. And so it's also going to be, you know, how do you convince someone to do it? And it can be very difficult. You have to have a combination of connecting their long-term goals to skills use, and that if they can see the wisdom, if they've got a long-term goal and they can be motivated towards that, then using these skills on an enduring basis is the way out. But it would be as if saying, you know, I took a Japanese class and I still don't know how to speak Japanese. That really it does mean a lot of practice, because it is a skill that the brain develops. So distress tolerance skills and mindfulness will develop over time, and it's a stick-to-itiveness that's going to get you there. And then when the person feels like giving up, reminding them that this is consistent with.
So that is a perfect segue into our next question. So one of our participants says, I have been practicing mindfulness for almost a year for BPD and anxiety and other issues. While it has helped some aspects of my struggles, for some reason I can't seem to shift the physical anxiety I struggle with on a regular basis. Do you think I need to consider something further, such as medication or trauma therapy? Am I missing something?
So, I mean, certainly mindfulness is not a panacea in the sense that, you know, in people with chronic pain syndromes, I mean, mindfulness-based stress reduction, MBSR, has been shown to be very powerful in the treatment of pain syndromes. But what that does is it reduces the suffering associated with the pain, but it does not take away the pain. So mindfulness can help reduce the level of anxiety. So the interesting thing would be to say, okay, what did the participant look like before mindfulness versus in terms of anxiety versus after mindfulness in terms of anxiety. And so it might reduce a lot of the suffering thoughts, like, oh, I'm feeling really anxious, and therefore I'm going to fail a test, and therefore my life is worthless, and I'm going to live collecting Coke cans or something. The mind can spin out of control in that kind of way. So mindfulness might just allow the person to be more present. But then you still got physiology that you might need to treat. And in that context, yes, certainly medications or other forms of treatment might be indicated.
Okay. And I think this will have to be our last question for tonight. As someone with BPD, I am terrified of changing myself as my sense of self is so weak. Can mindfulness be a tool in overcoming this fear?
You know, there's wisdom and greatness in all of us. Not a single one out there, not a single one of us is a second-class citizen. We tell ourselves these awful stories about ourselves. We're afraid to see the greatness within ourselves. And I think that the person who wrote that is someone with greatness within them, and mindfulness, true awareness and paying attention, recognizing the interconnectedness of all of us. Here we are, all of us, sitting on this webinar, doing this thing together, connected. We're all part of this one thing. No one is diminished or great in this. And so I think that mindfulness can bring to awareness the greatness within each of us if we don't have the fear to look.
Great. Thank you again, Dr. Aguirre. I want to remind all of our participants that this recording is, or this webinar was recorded and will be available on our website. I've also just posted on your screen the registration link for the next webinar, which will take place Thursday, December 10th, from 4 to 5 p.m. Eastern Standard Time, featuring Maureen Smith, Director of Family Services in the Adult Outpatient Clinic here at McLean Hospital. And that webinar, again, I want to remind you, is going to be even less of a lecture. We're going to talk about family struggles and strategies to address common challenges. And that webinar is really going to rely largely on you to bring us your questions, your challenges, and we will get through as many of those as we can. So we hope you can join us for that webinar as well. Good night, everyone.